You take calcium every single morning because your doctor told you it would protect your aging bones from breaking. But that same calcium is silently blocking your thyroid medication from ever reaching your bloodstream in the first place. Meanwhile, the ibuprofen you trust for a simple headache is quietly raising your blood pressure right back up every single time. Your own medicine cabinet could be the reason your prescriptions are failing, and your doctor would never even suspect it. 400%. That is how much your risk of a dangerous drug interaction jumps with ordinary over-the-counter products. Consequently, thousands of patients end up in emergency rooms every single year because of products they bought without any prescription. But the most important part is that nearly all of these dangerous interactions are completely preventable with one simple change.
This video is for educational purposes only and does not replace professional medical advice from your doctor. Over-the-counter products feel completely safe to you because anyone can buy them at any local pharmacy without a prescription. But safe for the general population does not mean safe when combined with your specific prescription medications every single day. In fact, drug interactions are one of the leading causes of preventable hospital admissions in patients over the age of 65. Today, I will show you exactly two critical categories that every patient taking regular prescription medications needs to understand immediately.
Let us start with supplements and antacids, PO, the products most patients never suspect could be blocking their own medication. Because what most people do not realize is that their own daily supplements are quietly fighting against their prescriptions every morning.
You take calcium to protect your bones, but that same calcium taken with thyroid medication directly blocks its entire absorption. So you might think the simple answer is to just stop taking calcium and choose a completely different supplement instead. But magnesium and iron supplements create the exact same blocking effect on your thyroid hormone and essential antibiotic medications. Likewise, antacids containing calcium or aluminum are equally dangerous when you take them alongside your common daily prescription drugs. Furthermore, proton pump inhibitors like omeprazole also quietly reduce absorption of the critical osteoporosis medications your doctor prescribed. So a patient treating simple acid reflux could be unknowingly destroying their own bone density treatment at the exact same time. A 2020 review in Therapeutics and Clinical Risk Management confirmed these interactions remain chronically under-recognized by most doctors. But the fix is surprisingly simple. You do not need to eliminate these supplements. You just need to change your timing. Specifically, spacing your supplement or antacid 2 to 4 hours away from your prescription medication solves this entire problem completely. Therefore, ask your pharmacist about every supplement and antacid you currently take. That one conversation could change everything.
Now let us talk about common pain relievers, HO, the ones that can silently raise your blood pressure without you ever knowing. Because the same pill you take for a simple headache could be secretly undoing everything your blood pressure medication actually does.
Ibuprofen and naproxen, sold everywhere as Advil, Motrin, and Aleve, are taken by millions of people every single day. But these pain relievers force your kidneys to retain sodium, and that directly raises your blood pressure in susceptible individuals. Consequently, if you are already taking blood pressure medication, regular NSAID use can partially undo your entire prescription treatment. A large analysis published in PLOS found that regular NSAID use raised systolic pressure by 5 millimeters of mercury. 5 millimeters sounds harmless, but over months and years, it measurably increases your risk of a heart attack or stroke. Furthermore, NSAIDs also weaken the effectiveness of diuretics, ACE inhibitors, and ARBs, the most commonly prescribed blood pressure drugs. So, your doctor raises your dosage because your numbers keep climbing, but the real culprit is sitting in your medicine cabinet. Fortunately, acetaminophen is a much safer alternative for pain relief in patients who are currently taking blood pressure medications. However, patients with chronic arthritis who need daily pain relief must work with their physician on a specific long-term treatment plan, because short-term, occasional NSAID use is a completely different clinical situation from taking these medications every single day for pain. Knowing this one fact today means you can protect yourself at the pharmacy long before the real damage ever begins.
By the way, I covered other crucial details on this topic in my full video, Tau. The link is on the channel. Subscribe and drop a comment hand. How many of these products are sitting in your medicine cabinet right now without you knowing?